We've been talking about kidney failure, kidney failure, kidney failure. Now, most people don't even know what this is, and I'm sorry about that. I will be explaining to you the two types when they say your kidney has failed, or the two types of kidney failure, and what it is, that's what it means that you have kidney failure. Now, there are some type of kidney failure that is reversible, okay? There, when you have it, kidney injury, your kidney can come back. Why there are some that it will never come back, apart from kidney transplant, that's getting a new kidney, or dialysis, which will just maintain you for some time until you get a kidney transplant done. Then I'm going to be telling you about the causes of kidney failure. Yes, all the causes of kidney failure, I will be telling you. I will try my best not to make it so hard, okay? I won't, for the professors, right, for the health, because trust me, a lot of healthcare people are on this page scrutinizing whatever I say, even on my YouTube, even on my Instagram, making sure I don't give people information that are wrong, which I appreciate. However, so for the sake of these people scrutinizing my videos, I try as much as I can to bring my terminology to the barest minimum where people cannot understand. So I'll tell you, I'll just list them out. No need to classify them if they are under acute or if they are under chronic. So let's get to kidney failure. Kidney failure means when your kidney can no longer perform its functions, which is make urine, do your blood pressure, maintain your blood pressure, produce red blood cells, a lot of things, okay? When your kidney can no longer do those things, it has lost its filtering capacity and ability. So this is where you now start bloating, your eyes start getting big, your legs start, you can't urinate, your legs start getting big, your stomach start getting bloated, okay? So this is what kidney failure means. Now, we have two types. One is acute kidney injury and the other is chronic kidney injury. Now, in acute kidney injury, it means that there's a sudden assault to your kidney. Something happens suddenly to your kidney that makes it lose its function. Now, when you notice this early, when you're found out that you have acute kidney injury early, this is why I always tell you to always check your kidneys. Don't wait to see these signs that you started bloating and all of those things, okay? So when you notice it early and they find out that it's at the stage of acute kidney injury, there are some managements that will happen. There's what your doctors will stages they will put you through and the kidney will revive. However, when you don't find that early, it can lead to chronic kidney injury. And in chronic kidney injury, when they say you have chronic kidney injury, CKD, in case I keep mentioning about CKD, know that this is what I mean, CKD. Okay, so this is what it means to have kidney injury, kidney failure. Okay, now a quick one in the aspect, so this will now bring me to the causes of kidney failure. I'll be telling you, combining together causes of chronic and causes of acute. Remember, acute is when there's sudden something happens, and when it happens your kidney can be revived. For example, there are people that have accidents, they lost a lot of blood, the kidney needs blood. So if the kidney does not get a lot of blood, these people can enter into acute kidney injury. When intervention is done immediately, they can get their kidney back, okay? So I'll be telling you the causes. So I'll combine this together and tell you the causes of kidney failure, whether chronic and acute. Get to causes of kidney failure. I've also made a video on the symptoms of kidney failure, why you may know you're having kidney failure, so there's no need of that. Number one causes, general causes of kidney injury, general causes of kidney failure is high blood pressure and diabetes that are untreated or unmanaged. So this is why I keep telling people that you need to take your blood pressure serious. If you have hypertensive, please take the drugs they give you. Manage it well. Make sure you do all those tests that I made. I made a video on people that are hypertensive and diabetic. There are some tests you will do. Each have their tests in locate it for the sake of this video is just about causes of kidney injury, so I don't escalate the video. There are tests you should do if you're hypertensive and if you're diabetic. Make sure you do those tests at least twice or once in a year, okay? Because some of these hypertensive drugs too are not good for your kidneys. They also damage the kidneys, but you must take them. However, though there are some certain types of antihypertensive drugs that do not damage the kidney. So these are the things you need to be aware of, okay? So now most people don't know that they are hypertensive. This is where I'm getting at. When you don't know that you're hypertensive, your blood pressure can damage your kidneys if they are high over a long period of time. This is why people in the village are suffering from this kidney failure and thinking that they are bewitched or they have witchcraft or they poison them because their legs get swollen. It's because they're having kidney failure because nobody is checking their blood pressure, and because of that, their kidney is failed. Diabetes, the same thing. It damages your kidneys. That's why you now start seeing protein in the person's urine. The filtering capacity of the kidney begin to lose its filtering capacity gradually. It destroys the kidney. So if you're on diabetes, take your medicine serious, manage it, strict dieting. I've made a video about diabetes, how to care for your food, a lot of things about diabetes. Please locate the video in this my YouTube, okay? Now, another causes of kidney failure is blood loss or fluid loss. I've explained that in the cases of accident. Now, if you're not drinking enough water, this is bad. Drink water whether you are thirsty or not. Have it at the back of your mind that you're drinking this water for your kidneys, not because you feel thirsty, okay? Especially people that work out, okay? Now, severe burns, that people that have burns, this, affect the kidney. Then infection, even in the cases of systemic infection, in the cases of urinary tract infection that people don't treat, gradually it affects your kidney, and your kidneys may damage. So take infections seriously and treat them. If you have malaria, it's part of infection, treat it. Malaria is not good for the kidney. Even anti-malaria drugs are also not good for the kidney. However, try to make sure that your malaria drugs are not expired and protect yourself frequently so that you will stop getting infected with mosquito bites. Now, another one is glomerulonephritis. It's just an inflammation of the kidney. Sometimes there's no really cause of this, okay? However, just try to be careful, reduce the way you take alcohol. This can also help, okay? Now, there's some infection also like COVID-19, some serious infection. There's a condition called lupus, okay? It's an immune disorder where your immune system starts attacking your normal cells, okay? Thinking that you're, seeing your body as an infection or something that is toxic. I will do that on a separate video, okay? Some medications, for instance, some cancer medications, and abusing NSAIDs, okay? NSAIDs mean ibuprofen, nasoparin, diclofenac, Panadol. Taking them in excess will harm your kidneys. Please be aware. I've been saying this a lot. It will harm your kidneys. Find out what is causing your illness instead of suppressing them. These are toxic to the kidney. Just take it when necessary and when prescribed. Now, there's some medications too that are used during some imaging. People that do MRI, CT scan, make sure they give you normal saline. After injecting that thing that they inject to you, they give you something. They give you normal saline to wash it off. This is a very important information, okay? Now, in the aspect of urine blockage, there are some kidney stones. If there's kidney stones and it's not removed on time, I've made a video on how to remove kidney stones naturally and who should not do this and what it will happen to you when you don't do this. So when kidney stone blocks, when kidney stone blocks the connection of the urine, where the urine comes out from the kidney, there will be stasis of urine goes back and store in your kidneys and store in your bladder, causing infection back and forth, and this can infect your kidneys, okay? And over time, when it's not treated, your kidney may fail. Prostate cancer, cervical cancer, any kinds of cancer, any kind of cancer, it can press on the parts, the urinary tract, so fluid will not come down the way it's supposed to, and this can, you know, cause infection and a lot of things, and then impair your kidneys. So please be very careful, okay? Be very careful. Breakdown of tumor cells, rhabdomyolysis, which is working out too much on a very high intensity, and especially in the sun where your muscle tissue begins to break down. It release this toxic substance, right, rhabdomyolysis, and it is very not good for your kidneys. So please be careful and drink lots of water, okay? Okay, so that is all about it. Herbs also, there are some herbs, for instance, the one popular ones in Nigeria, mixed herbs, mixed concoction. Be very careful. If it's not recommended by your doctor, do not take them. I keep telling people the ones that I know is ginger and garlic. Okay, that's the ones I know. I don't know about others. Be very careful taking bark of trees as roots. These things may be detrimental to your kidneys because you don't know the amount that you should take. Now, if you take lots of caffeine, reduce the way you take caffeines too. They are good though, but when you take it too much, you know, when you take caffeine, have you noticed you use the toilets a lot, you urinate, because it makes the kidney, you know, constricts the kidney, makes it work also. So please be mindful of how you take caffeine, okay? Try to maintain a good body weight, work out, check your kidneys, check your your BP. If you're hypertensive, manage it very well, okay? Do the test once in a year. Make sure you do kidney function test once in a year, okay? So that early, it's better to know early than not knowing at all. When you know early, it can be prevented, okay? So on my next video, I'll be talking about people that already have kidney issues, diets on what to eat on kidney issue, or if you are dialysis, if you be diagnosed of acute kidney injury, what to do, how to, you know, things you can do maybe to revive the kidney a little, okay, if it is still in acute stage. And let me know if you have any questions, and you can drop them on the comment section or chat me on my Instagram. Have a lovely day.